want to do is to avoid the nerve root that is descending. We want to get here. The L4 nerve root is coming out underneath the L4 pedicle. The L4 nerve root is going here. The L5 nerve root is going there, and that's what we want to decompress. So the L4 nerve root can be in jeopardy, and so when we enter, we monitor the L4 nerve root until we're centered in the disc where we want to be. And then we switch to monitoring the L5 nerve root, which is what we want to decompress. So this gal has a narrow disc between L4 and L5. It's readily accessible. And what I like to do as far as placement, unlike the standard, just put a naked laser fiber diagonally across the disc. What we try to do is to get it on the side and in the area where the disc bulges.
I think deep down inside we know it was the right time.
And so on image, what I like to do is to keep it in the posterior third or quarter on the lateral view, and in line with the pedicle on the 18 image, it's there. So instead of putting a fiber here, remotely where we want to be, I want to put it here, so that I'm right behind that contained disc. If we decompress that area, that should allow the annulus to contract backward and get away from the nerve root. So my ideal placement is going to be about here, which will put me about here on the lateral, and about there on the 18. About between 8 and 10 centimeters lateral to the midline, and about a 60-degree angle to get the right descending right across where we want to be. So we're on the core root, and what we look for on SCP, if you get too close, or I impinge the nerve root with this piece of metal, we'll see a spontaneous potential. We'll see a spike, and we know to redirect. So we'll get to the skin, and there's another push through the fascia. Go down slowly while they monitor the descending nerve root until I get to something solid, which I am there. And so I'll make room for the working cannula. Extending this puncture wounded stab wound. About a centimeter or less. For some reason, this is the bloodiest part of the case. Now, this working cannula has a cutter in it that extends just beyond the cannula itself and is sharp to get us through the annulus. These are the connections for inflow and outflow and all that good stuff later. And this little apparatus, once you've got your position set, just at the skin, and tighten it. What it does, it keeps you from inadvertently drifting further into the disc. There are some things on the other side of the disc that we don't want to get into. So we slide this over the guide wire. And cut our way through here. Work our way down. When we get to the disc, it's a gritty feeling. Gently get beyond that without plunging. And see where we sit. Now, this apparatus, I use a Zimmer pump. We're going to be getting something different because this is the last of an old breed. It works very well. You need to have inflow, and I like to have positive pressure inflow. So this tubing is set up for this particular apparatus where we have suction coming out here, inflow going down the tube, and this is the apparatus itself, flexible catheter. Carmen has already done me the favor of hooking up the light source, which is a light cable, and the camera cable. And this is the handpiece. This is the flexible catheter. And at the end of that, I don't know if you can appreciate, but in there, there's a Heaney beam for guidance. But the laser fiber is in there along with the camera, light source, and inflow. And this laser fiber is extendable and retractable. And it's also flexible, so once we're in the tube there, I can direct it a little bit based on this trigger here. This tends to stick. You have to be careful with this guy. So the laser cable is here for that. This is the water inflow, saline. And just to keep things cool, not that you need to, because the wavelength doesn't overheat the spinal canal at all. Yeah, I know. It doesn't overheat the spinal canal at all. However, the seal with a lens sometimes comes apart if it gets too hot in the tube. And so I asked them to chill the saline. So it's sitting in a hospital refrigerator right next to the vodka. Sometimes we make a mistake. This is outflow. This is a little aperture. You can actually tighten this down. It's almost like a sphincter. So we're hooked up there. We're hooked up here. Take this off and make sure we have adequate saline flow. So on goes the pump. And here it comes. Good. All right. So we got the flow. And in we go. See what's happening? I made a hole here, not closing over. So I created a defect, and this material is filling in, which is great. That's what I want. Process. But it is the same thing. You're ablating the tissue. Not trying to shrink it. Which is not affected anywhere.